global heart disease. So, what is the overall issue? Heart disease is a main cause of death in all countries globally and is the third leading cause or above, and is a growing and continuing epidemic. Heart disease is a non-communicable disease which is characterized by having blocked or clogged arteries, which can lead to stroke and heart attack. So as you can see based on this graphic, heart disease is typically caused by unhealthy lifestyle and then therefore can lead to stroke and heart attack. So who is affected by this issue? Heart disease could potentially affect anyone, although tobacco users, the obese, those with high blood pressure, and the physically inactive are much more susceptible. And as you can see based on this graphic, the causes of heart disease are primarily aging, genetics, unhealthy lifestyle, gender, as men are more susceptible, smoking, diabetes, and poor diet. Based off this graphic from the World Health Organization, the highest cardiovascular disease death rates are in the following countries in both men and women: the Russian Federation, Ukraine, Romania, Hungary, and Cuba. So who sees cardiovascular disease as an issue? Most people in countries view heart disease as an issue because of its exponential growth internationally, but especially the American Heart Association and the countries most greatly affected by this disease have both contributed significantly to reducing the risk of heart disease in their countries. How has the media covered this issue recently? Well, the CNBC stated that in 2016, heart disease in America rose so significantly to the point where it increased mortality rates. Additionally, media coverage from the Center of Disease Control stated that increased rates of heart disease has been linked to an increased rate of cancer. So what makes this issue so hard to address? Well, in less developed countries, infectious diseases are more prominent than non-communicable diseases like heart disease. So, little investment is made in research to determine how to prevent or lower the rates of heart disease because more emphasis is placed on infectious diseases and eradicating those first and foremost. And furthermore, without government support, it is almost impossible to lower mortality rates. In more developed countries, this would require a cultural and social shift to lower mortality rates, which is very hard to achieve. Additionally, a significant lifestyle change would be necessary from a large percentage of the respective country's population to reduce heart disease, and this requires an intrinsic motivation which the government can do little to encourage.